So let's take a look at what our armamentarium is. Of course, we have our topical agent, typically administered on a Q-tip or cotton applicator. We want to dry the area first. So before you paint the paste on there, take a dry piece of gauze and dry the area, a dry piece of gauze of course, but dry the area of the mucosa. That will, and you're wiping it off as well too, remove some of the normal coating that the tissues produce to protect themselves, and therefore allows your topical anesthetic agent to be more effective. Place a topical in there. Again, with young children, you can discuss with them the flavors. Our local anesthetic suppliers or topical agents typically provide very many different flavors. We just have this one flavor, and I always ask the kid, do they want raspberry, banana, or pineapple, and they pick one, and we use the same paste, and no matter what they pick, I said, yeah, that's what we chose, and they intuitively think that's actually the one we gave them. We'll then inject a little bit of local anesthetic solution into the area, and then follow it up with the additional agent to get our profound block. Now, as I mentioned earlier, one of the issues has to do with needle gauge. Now, one thing, obviously, if we come to a child with this very long needle and syringe apparatus, I think that's going to create some significant apprehension in the child. The other issue is controlling the volume of injection that we give in one time. So by using one of these small devices such as this, each little click or depression of this lever here dispenses 0.1 ml of solution. So this way it controls very nicely a small volume of agent to be administered. And you can use a 30 gauge needle on this. It's a short needle. We don't want to use a long 30 gauge or even a long 27, because if the child moves or fights us, that could break off and that can create a problem. So use a short needle. Obviously you don't want to bend the needle. In this syringe here, I'll usually have some plain 3% mepivacaine. So again, the idea of giving a little bit of an injection with the mepivacaine first does not have the vasoconstrictor. It'll have a more normal pH of the solution, therefore it won't sting and burn quite as much. And what I tell the child, say, is listen for the click noise and hit it one click and it'll be a little click. And really, if you've placed good topical anesthesia in the area, they won't feel that injection at all. And then waiting a few minutes for the mepivacaine to anesthetize the local tissues, so then we can go back with our articaine to get an appropriate volume and number of molecules in that area to get good profound local anesthesia.